So the acronym trong ngày liên tông trong một bên đến với tông trong một là IgA nephropathy clinical feature diagnosis. Tông trong một trong ngày như thời có thể ấy chỉ IgA nephropathy. IgA nephropathy cái most common mối là primary glomerulonephritis mối. Đây thì chúng ta đang mùa hè tế hay IgA đấy mà tông trong một epidemiology cứ chỉ lấy dòng mối là thuộc về primary glomerulonephritis để vì feature là East Asian nơi Asian hay là clinical manifestation mỗi là dân ai học cứ asymptomatic hematuria hay là proteinuria. Patient cho mỗi là IgA nephropathy này patient qua cột dụ và đáp ứng incident như cái cứ nơi second and third decade of life. Đã cho bộ đó cho anh chị một sự đấy. Thế một tô mỗi pathology IgA nephropathy này cứ patient cứ mình bắt đầu mình xong ra deposit of IgA nephropathy để ai có hỗ trợ man tam để immunofluorescence ការពាក់ព័ន្ធ immunofluorescence microscopy ជា IgA គឺសម្បូរច្រើន dominant ហើយ co-dominant មានសង្ខារ deposit of IgA វាអាចក៏មានផងដែរនៅ IgA ឬក៏ IgM ឬក៏អាចទាំងពីរម្ដងតែម្ដងគឺ IgA និង IgM តែវាពីទៅដោយ IgA predominantly គេមាន J chain មួយទៀតដែលមាន polymetric metric IgA មួយជាមួយ predominant lambda light chain ហើយការពាក់ព័ន្ធ immunofluorescence គឺរកឃើញនៅក្នុង IgA nephropathy វាអត់អាចញែកដាច់ពី IgA vasculitis ទេហើយ complement មួយចំនួនដូចជា glomerular deposition of complement component C3 ដែលអាចរកឃើញរហូតដល់ 90% នៃករណីហើយការវត្តមាននៅ C4D deposit អាច signify leptin pathway activation ដែលអាចវត្តមាននៅ C1Q ដែលជា risk factor មួយរបស់ post long term kidney outcome នៅក្នុង IgA nephropathy ចំពោះអីផ្សេងៗទៀត glomerular fibrillary deposition យើងឃើញផងដែរនៅក្នុង microscopy មេថងយូមហើយនិងជាមួយនឹង endothelial cell fast ជាទូទៅឃើញនៅក្នុងជំងឺ IgA vasculitis ហើយនិង scleroderma nephritis ចំពោះការពាក់ព័ន្ធ light microscopy សំទោសការប្រើឧបករណ៍ light microscopy វិញយើងឃើញមានសង្ខារ IgA deposition diffuse ហើយនិង global នៅក្នុង IgA nephropathy ដែលអាចបង្ហាញថាជា heterogeneity in pathogenic response to this position ដែលអាច focal ទីតាំងតំបន់មួយ50ជា 50% នៃ globally ឬក៏ហើយនិង segmental major finding នៅក្នុង light microscopy គឺមានសង្ខារ hypercellularity ហើយនិង matrix expansion គេជាទូទៅអាចឃើញជា focal តិចជា 50% នៃ globally ហើយនៅជំងឺដែលមាន IgA nephropathy ហើយនិង rapidly deteriorating kidney function បង្ហាញថាមាន segmental necrosis ឬមានឬក៏មិនមាន crescent formation គេហៅថា capillarity dialysis បន្ទាប់ទៀតគឺបន្ថយនៅ glomerular filtration rate ហើយនឹងបង្កើននៅ proteinuria ដែល associated ជាមួយនឹង kidney biopsy feature ឃើញដូចជា glomerulosclerosis tubular intestinal inflammation tubular atrophy និង intestinal fibrosis ចំពោះ traumatic microangiopathy ដែល association ជាមួយ IgA nephropathy ដែរគឺវា associated uncontrolled ឬក៏ malignant hypertension ហើយនឹង portent a poor kidney outcomes electron microscopy យើងឃើញមាន electron dense deposit ដែលស្ទុះទៅនៅក្នុង mesangium ប៉ុន្តែក៏ឃើញមកដែរនៅក្នុង subendothelial និង subepithelial spaces ដែលជា evidence បង្ហាញថាជា IgA nephropathy cases ជាមួយ clinical feature ស្តៀងជាមួយ minimal changes បង្ហាញ feature typical podocytopathy for the classification IgA nephropathy based on the histologic variable predict out kidney outcome នៅក្នុង patient ជាមួយនឹង IgA nephropathy for classification ចែកចេញជា4ដំណាក់កាលជា score 4 score of 0 បង្ហាញថាមានចំនួនតិចជាងច្រើនជាង4នៃ mesangial cell ដែលមាននៅក្នុងតំបន់ mesangial area គេហៅ mesangial hypercellularity score បន្ទុកទី1ដែលមួយបង្ហាញថាមាន4ទៅ5 mesangial cell នៅក្នុង mesangial area score ពី2ទៅ6score 2គឺចំនួន6ទៅ7 mesangial cell ដែលមាននៅក្នុង mesangial area 1 score 3បង្ហាញថាមានធំជាង cell mesangial 8នៅក្នុង per mesangial area ចំពោះ endocapillary hypercellularity ចំណាត់ថ្នាក់ទីបន្តមួយទៀតគឺយើងឃើញមានករណី E1 បើសិនជា hypercellularity គឺមានវត្តមាននៅក្នុង glomerular capillaries lumen ហើយភាសាដែលធ្វើឲ្យមាន narrowing of lumen ឬក៏ absence of if no hyperosmolarity is present within lumen. Segmental glomerulosclerosis គឺបង្ហាញថាមានវត្តមានផ្នែកមួយនៃ glomerular tuft ចូលទៅក្នុង sclerosis absent បើសិនជាគ្មាននៅ segmental glomerulosclerosis present ចំពោះ tubular atrophy atrophic fibrosis គឺវាបូកជាមួយនឹង tubular atrophy ឬក៏ atrophic fibrosis crescent គឺវត្តមាននៅ sclerotica ឬក៏ fibrocellular crescent ដែលមានវត្តមានយ៉ាងហោចណាស់ក៏មានមួយ C-on ហៅ C-on ពីសិន at least 25% នៃ glomeruli biopsy ជាមួយនឹង glomeruli តិចជាង 8 អាចនិយាយថាវាអត់ទាន់ច្បាស់លាស់ទេ process ជាមួយ dialysis របស់គាត់ចំពោះ IgA deposit នៅក្នុង healthy individual អាចរកឃើញនៅក្នុង kidney biopsy ផងដែរតែគ្មាន evidence of kidney disease អាចមាន 3 ទៅ 16% ចំពោះ clinical features យើងឃើញថា clinical manifestation ដែលជំងឺនេះអាច asymptomatic microscopic hematuria ទៅ rapidly progressive glomerulonephritis. Clinical presentation among patients with IgA nephropathy including gross hematuria 40-50% patient person present ជាមួយនឹងមួយឬក៏ current episode of gross hematuria បន្ទាប់ពី upper respiratory infection អាចនិយាយថាជា symptomatic hematuria patient ជាមួយ complaint with flat pan during acute episode reflecting strengthening of kidney capsule low-grade fever may also be presented. This patient can be within drug infection or urodyschasis, which have only a few episodes of gross hematuria and that usually recur for a few years at most. In short, that episode of gross hematuria គឺនៅអាយុ40ឆ្នាំឬក៏ចាស់ជាងនឹងតែវាកម្រមកពី IgA nephropathy តែផ្សេងទៀតគឺ microscopic hematuria ឬក៏ without proteinuria. Some susceptible have microscopic hematuria and usually mild proteinuria and detected on routine examination or during diagnostic evaluation for chronic kidney disease. During microscopy, include dysmorphic red blood cell and particular urinary erythrocyte regarded as being an indicator of glomerular pathology. Most might eventually come in 20-25% of these patients. Nephrotic syndrome, rapidly progressive glomerulonephritis, វាទៅជាង10% ជាមួយនឹង either nephrotic syndrome ឬក៏ acute rapidly progressive glomerulonephritis បង្ហាញដល់ឃើញមាន edema hypertension kidney function impairment ឬផងដែរ hematuria កម្រនៅក្នុងបានញ្ញាត hypertension ចំពោះ acute kidney injury ក៏មានដែរអាចជា oliguria ឬដោយសារតែមាន crescentic IgA nephropathy ឬក៏ heavy glomerular hematuria វាធ្វើឲ្យមាន tubular occlusion damage to the red cell បើសិនជាមាន crescentic IgA nephropathy គឺវាបង្កើតចំនួន dysmorphic red cell ដែលវាពិសេសក្នុងទំនោរតែជាទូទៅតិចជាង 50% ឬក៏ red cell sin differences រវាង children ក្នុង children IgA nephropathy មាន hematuria ច្រើនជាង adult ដែលធ្វើឲ្យ dialysis ទាន់ពេល inflammatory lesion មានសង្កេត endocapillary hypertension more prevalent on kidney biopsy ក្នុង children IgA nephropathy compared with adult. Post-related causes for his include frequent episode of acute nephrotic syndrome and hematuria and high rate of clinical admission in children paired with adults. Post-associated condition was known IgA nephropathy associated with condition stage of chronic liver disease, alcoholic cirrhosis, most common form was secondary IgA nephropathy chronic liver disease due to the causes that applies B, C, and children, and stage liver disease and mostly alpha multi-substance deficiency or barely atrophy. One set of children may have asymptomatic microscopic hematuria proteinuria. The really multi may be seen children. Act result of suffering B12 liver transplantation, impair remove IgA containing complexes, gaffer cell and liver, predisposed to IgA deposition in kidney. So yeah, this is the emotion glomerular IgA deposition is common in this is the way of IgA complexes appear to correlate with disease theory. Hip infection collapsing, variant of core segmental glomerulosclerosis, classic glomerulopathy, necron heel infection, and glomerular disease associated with heel infection, including IgA nephropathy. Present IgA nephropathy present with growth in microscopic hematuria and symptomatic proteinuria paired with nephrotic syndrome. Monoclonal gammopathy of renal syndicate, group of disorder which monoclonal protein, variant of word pathology commonly subtype of globulopathy, alpha heavy chain protein disease and proliferative globulopathy with monoclonal immunoglobulin deposit. Glomerular disease modulation association for the glomerular disorder of saying it. Main motion disease, yes, it can be an IgA protein, main action onset of nephropathic syndrome, maybe act mean have methylation proliferation or kidney biopsy, and most problem finding is the food processed investment, the best deal, necromin motion disease, granulomatosis with polyangiitis. IgA that the main combination after immunosuppressive therapy. This patient had repeated upper respiratory infection, nasal immunosuppression, and present new hematuria, but no apparent recurrence of systemic prophylaxis or new infection in anti-neutrophils to plasma antibody titer. The later findings suggest the possibility of new kidney disease rather than relapsing vasculitis. There are also documented IgA deposition in patients with thin basement membrane nephropathy, lupus nephritis, diabetic nephropathy, membrane nephropathy, IgA dominant staphylococcus post-infectious globulopathy. His system saying that IgA associated with a variety of other diseases, including dermatitis multiforme, small cell carcinoma, lymphoma, dyseminated tuberculosis, bronchiolitis, obliteration, and inflammatory bowel disease, Crohn's disease, and ulcerative colitis. តែទៅមួយ dialysis នៅពេលដែលយើងចាប់ផ្ដើមសង្ស័យនៅពេលសង្ស័យគឺអ្នកជំងឺដែលមាន present នៅលើ following ឯកខាងក្រោមទី1អាចមួយឬក៏ច្រើន episode of growth bacteria especially combined by upper respiratory infection អាចមាន microscopic hematuria with or without proteinuria persistent microscopic hematuria with or without proteinuria slow progressive kidney function impairment patient with IgA nephropathy may present less commonly with nephrotic syndrome or rapidly progressive globulopathy. The dialysis, establishing the dialysis of IgA confirmed by kidney biopsy, showing immunofluorescence, immunoperoxidase, standing demonstrate present of dominant or co-dominant deposition of IgA. No specific laboratory finding can be used to reliably diagnose IgA. Kidney biopsy is not usually performed for patients presenting with isolated bacteria without evidence of proteinuria or impaired kidney function. Anyway, if there are signs suggesting of more severe progressive disease, such as persistent proteinuria or less 500 mg per day, or diabetic throne greater than concentration, education for performing of kidney biopsy. A number of other tests proposed for evaluation dialysis of IgA nephropathy, including measurement of polygalactose-selected IgA, O-glycoform, polygalactose-selected IgA, more specific IgG, antibody syndrome, and measurement of 10 microRNA. In fact, O-galactose selection of IgA on differential dialysis saying at a port syndrome. Port syndrome thì hydrogen nephritis muối là vitamin thin base membrane nephropathy. We measure P globulopathy with persistent isolated hematuria, family history with without diagnosis. Post-Streptococcus glomerulonephritis with cross hematuria of upper respiratory tract infection. Time interval between antigen development of hematuria is longer in PSUN, more than 10 or less than 5 days. Patients with IgA nephropathy may have repeated episodes of cross hematuria which are dry in PSUN. Immunocomplex monoclonal immunoglobulin or complement-related membranoproliferative glomerulitis, episode cross hematuria in children young adult. IgA dominant staphylococcus associated glomerulitis, the reaction kidney injury, hematuria, and proteinuria. Although they are present and those with diabetes most commonly affected. Most cases associated with staphylococcus or inspection. The full proliferative glomerulitis with presence of neutrophil and subclavian and subendothelal retron dance. Deposit more prevalent staphylococcus associated glomerulitis. IgA nephropathy henoxacolon prevara. So identical to that IgA nephropathy. However, IgA vasculitis are described in non-maintained rash, aspiration, and abdominal pain. Lupus nephritis admin methylation IgA deposition. Lupus different from IgA deposition by permanent exposure of IgA, IgA, and presence of subsexual COQ deposition, activation of classical complement pathway, activation of alternative lectin pathway in IgA nephropathy. Other differential diseases include Fabry disease, non-IgA methylation proliferative glomerulitis, monoclonal syndicate, including IgA, PGMID. បាទ មេនេះនេះត្រូវបានបញ្ចប់យើងមើល graphic ទាំងអស់គ្នាទៅចូលជាមួយរូប បំពាក់ពណ៌ immunofluorescence microscopy បង្ហាញថាមេសង្ឆា immunoglobulin IgA deposit គឺបង្ហាញ large ហើយនឹង globular មេសង្ឆា IgA deposit characteristic of IgA nephropathy IgA vasculitis capillary wall are not outlined since the deposit are primarily limited to the mesangiome រូបទី2បង្ហាញពី globular normal right microscopy or normal glomerulus only 1 or 2 cells per capillary unit the capillary lumen are open the thickness of glomerular papillary wall is somewhat similar to that of tubular basement membrane and the mesangial cell and mesangial matrix are located in the central or stark region of the top រូបទី3បង្ហាញពី microscopy showing mesangial proliferative glomerulitis like microscopy mesangial glomerulitis segmental area of increased mesangial matrix or cellularity finding alone can be seen in many diseases with IgA nephropathy and lupus nephritis រូបបន្ទាប់ទៀត electron microscopic មានឃើញមាន normal glomerular capillary loop showing penetrated endothelial cell glomerular basement membrane GBM ហើយនឹង the epithelial cell interdegenerating food process the GBM is thin and no electron dense deposit represent two normal platelets as seen in the capillary lumen. Okay. Electron microscopy shows mesangial immunoglobulin A IgA deposit. You can low power electron microscopy IgA nephropathy. The primary electron dense deposit that are limited to the mesangial region. The glomerular base membrane is normal. And there are no glomerular capillary wall deposit. អញ្ចឹងមេរៀនយើងតទៅជាមួយនឹង IgA ទៅបានបញ្ចប់សូមអរគុណអរគ្នាបានតាមដានតាពីដើមដល់ចប់